Okay.
Anything else?
I think we'll wrap up that discussion for today and move on to the presentation. But throughout the presentation, feel free to unmute yourself or write in through that chat box if you have questions.
Yeah. Now, I'm going to put Dr. Andraki and probably a bunch of others to sleep because they've heard this probably 18 billion times. We're just going to go through some basics of the biology of addiction. If you got any questions along the line, yes, please feel free to interrupt. Risk factors for addiction, there's biological and genetic. And the one question you're going to ask anybody that's going to predict whether or not they're going to become physiologically dependent upon one of your medications that's addictive is there a family history of addiction? That's one that should always be asked and always be known about before proceeding with the dispensing of any addicting agents. There are also environmental risk factors. This is obviously a multifactorial issue. It's my belief that the things that get you using oftentimes are environmental and interpersonal psychological. Adolescence is a time of experimentation and a time of natural psychosis, and so they're more likely to try stuff, driven by everything from peer pressure, parents' attitudes about drugs, the availability of drugs in the area, trauma. A large number of our patients have got trauma histories. Adolescence is also a time of natural angst and the feeling of a need to try something to see if they can change that angst. Sex, drugs, rock and roll, separation from family are all ways they can try to alleviate that angst. And so they're more likely to try drugs. The genetics then takes over in terms of how they respond to that drug and whether or not they become physiologically dependent or whether they use it for a while and say, well, that was nice, but I'm moving on to something else. This is just kind of a fancy little way of kind of pointing out how the biology, the environment, the drugs themselves can all combine to lead to addiction. And this is one of the things that I want people to kind of use as a mindset when they think about the overall issue of addiction. And that is what there are significant differences in the mechanisms of what gets us to use, what keeps us using, which is different from what keeps us from stopping, and then what gets us using again. Each of these processes has multi-interactions with different circuitry within the brain. And so just getting somebody to stop using generally isn't enough. Because there are other processes that are going on that's going to get them to use again. In a nutshell, addictions are the hijacking of the reward system through the dopamine inputs into that reward system. The regulated drives we've got, and by regulated drives, I'm talking about the 4 Fs. Food, fight, flight, and fornication. These are all part of the reward circuitry. They're the outcomes of our reward circuitry, which includes certain areas of the brain, the ventral tegmental area, the nucleus accumbens. The nucleus accumbens is important. We're going to look at that in a minute, but that has everything to do with attention. Okay. And the nucleus accumbens is an admixture. It's part of the striatum, which has to do with learned behaviors and learned attitudes, and it's part of the amygdala, which has to do with emotional response. The prefrontal cortex, That's our decision-making areas of their brain. Is this good? Is this bad? What's going to happen if I use this? What's going to happen if I don't use this? And then areas of the limbic system proper, including the amygdala, which has to do with emotional responsiveness, the hippocampus, which has to do with memory, and the hypothalamus, which does a whole lot of stuff. And in this particular case, we were kind of mentioning it earlier, changes in the hypothalamus due to drug use might be why people put on weight after they stop using, because the drugs have affected areas of their hypothalamus. To kind of give you an idea of where these things sit, and I don't have a little pointer thing.
You can just touch with your finger.
Oh, okay.
Yeah.
So this area is what we were referring to in terms of our rewards. This is the ventral tegmental area that produces dopamine and sends it to the nucleus accumbens. The nucleus accumbens says, boy, howdy, this is important, pay attention, but it doesn't necessarily say what to pay attention to. That also has an effect on this area down in here, which is your amygdala, which is part of your emotional responsiveness, which interacts with the memory. Should I remember this thing or not? This is important in getting things into our memory, because it's not just seeing a lion, being attacked by a lion, and running away from the lion. It is all in the service of memorizing, where the hell did I see that lion, and should I avoid that area again? If I come across a crop of apples, do I remember that crop of apples next time I'm traveling into that area? To put it a little bit more succinctly in terms of modern times, you walk into the mall and you're walking around the mall and you're very specifically looking for certain things, and you start to get a little bit hungry, and you get a little rise in your dopamine as a result of hunger, and then suddenly sniff, sniff, Cinnabon. Okay. I didn't know there was a Cinnabon in here. That's an emotional response, which is going to be included in that in the memory. And then later on, if you walk into that mall, you're going to know that there's a Cinnabon in there. I like to point this out because when we're treating addictions, we're also treating memories. Those memories aren't going to go anywhere. Simply because they stop using doesn't mean they lose those memories. They have changed their brain permanently by drug use, and they're always going to remember that first drug use, that first kiss, the first time they tasted their favorite food. And so what we're attempting to do in treatment is to change their brain some more. We're not trying to change it back to where it was before, because we can't unlearn this memory. We have to move forward and give them more skills so that they can overcome what happens when they have that memory. Other areas that are important are judgment, including the prefrontal cortex, and movement, as well as sensations. So dopamine plays a key role in animal attraction. It allows for intense focus and drive. You ever been driving down the street and you're thinking about something else? Your mind's going various and sundry ways, and you're not necessarily paying a whole lot of attention to what's in front of you until your tire hits a pothole, and suddenly, bam, you are right in the here and now. Now, if we were to look at your nucleus accumbens, what we'd see is a massive dopamine spike. It says, pay attention, okay? And we're never more alive than in that moment. We are thinking faster, we're processing information. All of our senses are alive because we have brought the entire brain into focus on there's something important here, let's figure out what it is. Now, it may be food. We are hungry, and suddenly we see food, and we get that anticipatory response. If we're thirsty, by God, we see a water fountain, and it's the greatest thing since sliced bread, and we're looking for it like nobody's business. We see dopamine response elevated in response to passionate love. We'll see that in a second. in terms of what happens. We talk about it being the neurotransmitter of addiction. I don't necessarily like that term. It's the neurotransmitter of attention. And then the drug tells us whether or not we like it or not. But all drugs of abuse produce this spike in dopamine in that area of the brain. They then go on to subsequently do other stuff that we may or may not like. And that's what determines whether we become an addict to that particular drug or not. But all of them, first of all, they've got to get our attention. Now, it serves a lot of other functions in the brain as well. And when we muck about with the dopamine system, we muck about with a lot of other things in our head. But in terms of dopamine and addictions, that's where the action is at. The ventral tegmental areas, dopamine that goes to the nucleus accumbens. Just to show you that there are dopamine receptors throughout the brain, you find that stuff everywhere. The brain is lousy with different types of dopamine receptors, and they tend to localize in different areas of the brain. They also co-localize. D1 and D5 receptors, generally found in the green areas, D3 and D5 in the blue areas, which is the hypothalamus, and D1 and D2 in the corpus striatum. That's kind of where we're looking at the action is with addictions. It's part of our reward circuitry. And this dopamine producing area, the ventral tegmental area, is going to shoot information, dopamine, to the nucleus accumbens. Now, the nucleus accumbens tells you to pay attention and also alerts the prefrontal cortex to basically say, and what are you going to do about it? Okay. And activates the striatum, which has to do with movement, complex movement, in terms of, do I run from it? Do I run toward it? Do I go over and eat it? All of which is going to require specific behaviors that I've learned. So how to ride a bike, how to drive a car, how to pack a crack pipe. All of that type of complex behavior is part and parcel of this area of the brain right up in here, the striatum, which has to do with learned complex behaviors. And so you'll hear patients saying, I don't know, it just seemed like the car drove its way to my dealer's house. And the whole time I was thinking, don't do it, don't do it, don't do it, while I'm making the right turn into his driveway. Yeah, we've activated those motor pathways, and in a sense, they are doing that. Now, this is a little bit, the jury's still kind of out on this, but what this is showing is the report of a high, okay, of people when we get a change in the dopamine in their striatum. Okay. And so we'll give people a fixed dose of, this happens to be an amphetamine derivative in this particular case, and we begin to show increased activation, meaning increased dopamine levels in their nucleus accumbens, and more of them tend to report a high as their dopamine levels come up. We don't think that this necessarily is what causes you to be addicted to the drug. It might be part of it. But it certainly helps explain why you might end up being addicted to a behavior that causes that type of dopamine spike. Oftentimes we'll see our patients and you say, man, these people are addicted to chaos. You know, they're addicted to stress. They go out of their way to make their lives miserable in some way. And when they put themselves under stress, it's just like, you know, being attacked by a lion or having to run away from an assailant. That's going to give you a dopamine spike in your nucleus accumbens. And so while the behavior they're engaged in might be dangerous and bizarre, somehow they find it rewarding in some way, shape, form, or another. Some less, some more, but you can get a bit of a rush just by increasing dopamine in the nucleus accumbens. Now let's take a look at what we refer to as biologically relevant reinforcers. Food is a biologically relevant reinforcer. And we're going to look at, these are rats, okay, good old-fashioned, mellow California Wistar rats. And we're going to pop a little micro pipette down into their nucleus accumbens, and we're going to suck off the juices at various times and measure the level of dopamine activity in their brain. And so right here, the food box is empty, and they're running around 100%. That's their basal rate. They're running at 100% of their basal rate. And it varies. It goes up, it goes down. It's not just a complete flat line. And then I dump a bunch of food into their food box, and they start chowing down. Boom. Up to 150% normal. This is how they remember where to go to get food. Okay, pay attention. Here's where the feeding box is. Now, as they keep feeding and they develop satiation, the dopamine levels slowly fall, feeding time over, and they're back down to about 100. So that's what we see with normal, non-addicted rats. Now, what about sex? Okay, once again, we're going to play with the rats here. And here we are, they're at 100%. And down here, you notice nothing's going on. Okay. And then, right here, I present one female who's an estrus. And wow, look at this. Even before they've started having sex, that's over here, okay, just smelling the female, their dopamine levels begin to climb. They start showing off in front of her and flexing their muscles and winking and nodding. And then we start having the sex and get out of there. You'll notice that as the number of sexual encounters happens, dopamine levels begin to fall. Okay. So we're much more excited the first time around than we are the second, the third, the fourth, and the fifth. In fact, at this last go-around, where are we at here? Okay. We're about 150. And our first one was 200. So this kind of shows a couple of things that are important, and that is an extinction pattern. Okay. Does your sex become stale? Well, yeah, if it's long enough period of time, you're not getting the same dopamine response you were before. In fact, you're not even giving the same dopamine response later in the night than you were earlier in the night. And if you notice, this is about the same level that you get from eating. Okay, so at some point in time, a ham sandwich sounds a whole lot better than another rumble in the sack. Okay. This is to be expected. This is important. This is what keeps this system from burning out. Is that once you've, okay, yes, I can have sex with this particular female or this particular male. I can get this poor fool to come back each and every time. It begins to wear off, and now I know what it takes to entice this particular individual. I've learned what I need to learn, and my dopamine levels fall off. So the next time I want to have sex with him or her, I may not necessarily have this high dopamine spike. I don't need it anymore. I've learned what I've needed. I'll still get a dopamine spike because it'll still be reinforcing, but it may not be like it was that first time. That's important to keep the system from burning out, and it's different when we use drugs. Okay. The next thing I want to point out in this one is like, okay, the female goes away, and now we're back down to almost 100 here, and now I don't even begin to bring the female into the, I just know that she's in the room. Suddenly, I start to get another dopamine spike. This is anticipatory. Okay, this is very much anticipatory. Notice we didn't necessarily see it over here, even though the female's in the room. Okay. But when I bring the female in the room again, what I've learned is, oh, if she's over there, she's about to be over here. And I begin to get a dopamine rise. Okay. So this is an anticipatory response. We get an anticipatory response when things are about to happen. I want you to think about going to your favorite restaurant, and you've planned to do it earlier in the day, and you've talked about it all day long. Do you begin to become excited about it? After a while, does it seem to take on almost an excessive importance? Well, we can't do that. We got to get to the restaurant. Okay. We begin to focus in on that more. We begin to drive toward it more. We begin to have this dopamine response. We get excited about it, and other things that may be important are less important now because we're focused in on it. Drug addicts will do this as well. The old saying is that they'll entertain the thought to the point where they find the thought entertaining. They'll think about it, and they'll think about it, and they'll think about it, and they'll say, well, by that point in time, Doc, I knew I was going to use. They've got that dopamine spike going on. And so one of the things you're trying to do in treatment is getting them to identify those thoughts early and interrupt them so they don't give themselves a dopamine spike in anticipation of what might happen, which then goes on to drive the assuredness that it is going to happen. Now, I've just said a whole lot of words, but does that make any sense?
Yes.
Okay. I hope it is here. I hope it is out there as well. So let's take a look at drugs. Okay. Look at what happens when we take amphetamine. These are rats that I'm feeding amphetamine. Again, these are non-addicted rats. These are just mellow Wistar rats. Remember, 150 for food, 200 for sex. If I jack the nucleus accumbens with amphetamine, boom. Okay, I'm going up to 1,000% of my baseline. This is telling me, boy howdy, pay attention to this. And while other areas of the brain aren't necessarily as responsive, the nucleus accumbens sure as heck is. So that shows you how important these drugs are in terms of jacking up the nucleus accumbens. Let's take a look at cocaine. A little bit different. Okay. Not quite as quick. You know, look at this. Within an hour, within half an hour, with amphetamines, they've reached their height. With cocaine, it's a little bit slower, but we're still getting it up well above 300. Cocaine is more important than sex in terms of the ability to jack that nucleus accumbens up. So that's what we're dealing with. That's what our patients are trying to overcome, is that remembrance of boom, that high, that dopamine spike that one time they had it. And cocaine is even more important than sex. How about nicotine? Well, nicotine's pretty serious stuff itself. Very short period of time to its peak dopamine, and it's about 225. So in comparison to sex, it's 300. The next time it's 150. But a cigarette, well, that's 225. So maybe I want a cigarette. After the second or third time, maybe I want food. But all of these are comparative values that your brain is sorting through at the time. Now, you're not doing it with your cortex. You're not sitting there, gosh, do I do this or do I do that? But in terms of the other mechanisms of your brain sorting out what you, quote, want, we're looking at comparison. This versus this, one versus the other. Sex might be important now, but a little later on it's food. And then after that, it might be a cigarette. All of these are drives and are important when we talk about addiction. So that's nicotine. And finally, ethanol. Low count ethanol. Gosh, it doesn't even get to a peak until, well, almost an hour later. Okay, it's only getting to 200. So you look at alcohol and you go, boy, that shouldn't be very reinforcing at all. So why do we have so many alcoholics? Well, exposure. Greater amount of exposure to people, the more people who've got the biology are going to respond. The other thing is that while you may think that the height of the dopamine spike might mean that more people are going to be addicted, again, that's not necessarily so. When you look at percentage of people who develop cocaine dependence versus who develop alcohol dependence, it's in some ways about the same in terms of percentages of people who've tried it. And believe it or not, for the most part, amphetamines are the same way. Maybe 20% max are going to develop a serious long-term methamphetamine problem. So it's not necessarily the height of the dopamine spike that's going to say whether or not they become addicted, but it may have something to do with how rapidly that percentage of the population that's going to become addicted shows it. Much more rapidly with amphetamine and perhaps cocaine, followed next by nicotine, and well down the list, alcohol. It takes alcoholics a good couple of decades to really get the machinery lubricated and begin the downhill journey into living on the park bench. So I think this was, once again, just my way of pointing out some of the differences with our natural reward system and how they begin to extinguish over time on any one of these. The thing I want to point out is that, let's see if I can go back. This dopamine spike I'm getting, I'm going to get it each and every time I take the drug. Now, I may have to take more of it over time, but I will achieve that level of response each and every time I take the drug if I take enough of it. That is different than our biologically salient reward system. That tends to shut itself down so that we don't change all the neurotransmitters and their overall reactivity. When I'm using amphetamine, cocaine, nicotine, and alcohol for a prolonged period of time, I begin to change things so that I no longer respond to biologically relevant stimuli. The coo of my daughter's voice, the touch of my wife, a sunset, a good meal, those mean nothing anymore because they don't even register anymore. The only thing that registers is me using my drug.
So a couple questions that came in, and then I think we'll need to wrap up today. So the difference in hormone response between people who are predisposed to addiction and those who aren't are the rate at which the dopamine spikes?
We don't know. Okay, and part of the reason we don't know is because most of our studies are done in rats. We are able to stuff a dopamine spike down into a rat's head. I think there are some laws that prevent us from doing that with people. What we can say is that's one of the theories as to why some people become dependent and others don't. One theory holds that we actually are subreactive to normal dopamine spikes, and so when we get when we expose ourselves to amphetamine or cocaine, we say, wow, this is what must be like to be normal. So that's one theory. I personally think that there are a lot of different genetic variations that may allow you to become dependent on a particular drug. Some, it may be a dopamine difference. Others, it may be how you respond to mu receptors, opiate receptors. Others, it may be how you respond to second messenger systems. So there's probably a lot of different ways to skin the cat. But the one thing they all have in common is this dopamine spike, and then there's subsequent other changes that go on. That dopamine spike is critical in terms of developing addiction, but it may not be the single only factor that you need. Okay. It might not be required to be different to develop dependence, but all of those things that cause a dopamine spike are potentially addictable. Is there another question?
Just a question about if this talk is going to be available. So the slides are posted on our webpage, and we do record all of these. I think there is an older version of this talk on our recordings page if you want to take a look at that one. So we've got a few minutes left. Any other comments or questions for today?
Well, thanks, everybody. I'm glad we've got our folks from the East Coast, Delaware, and DC, and our folks at various and sundry sites around the state. Thanks all. We'll see you next time.
Yeah, so August 14th, we'll be back. Hope to see you then. Feel free to reach out to me. This is Troy Jorgensen. In the meantime, if you have any questions or concerns. Thanks.